Alright guys, so this is the first lecture for the billing and coding portion of the curriculum that you're going through, and this comes out of the insurance handbook for the medical office. So this is the textbooks that you're going to be using throughout this portion of the course, and this is chapter 1, which is basically just an introduction. It's the role of this insurance billing specialist, and throughout this lecture we're going to be talking about identifying the background of importance of accurate insurance claim submission, coding, and billing. We'll assess responsibilities assigned to the insurance billing and coding specialist and electronic claims processing. We'll name and discuss the office procedures performed during a workday that may affect billing, and we'll specify the educational requirements for a job as an insurance billing specialist and a coder. We'll also describe a variety of career advantages and areas of specialization open to those who are trained as insurance billing specialists. I'll list some qualifications, attributes, and skills necessary to be an insurance billing specialist, and then state the personal image to be projected as an insurance billing specialist, and then describe the professional behavior as well. So lots going on here. We'll also differentiate between medical ethics and medical etiquette, specify incidences when an employer and or employee can be liable when billing for medical services. We'll identify common practice and limitations of a claims assistance professional scope of practice to his or her clients, and then explain how insurance knowledge and medical knowledge can be kept current as well. So to start off here, we're going to talk about the background of insurance claims, coding, and billing. So medical insurance professionals deal with all aspects of claim submission. A physician will rely on professionals to handle billing, transmission, and then the follow-up on those claims as well. So there are two main types of billing. There's facility billing. And facility billing is done in hospitals, acute care hospitals, skilled nursing or long-term care facilities, rehabilitation centers, or ambulatory surgical centers. And then there's professional billing, which is done by physicians or non-physician practitioners, or NPPs. We'll talk about more about NPPs right here, actually. So non-physician providers. So some examples of non-physician providers could be like a physician assistant, nurse practitioner, advanced registered nurse practitioner, certified nurse anesthetist, physical therapist, speech therapist, licensed clinical social worker, or a certified registered nurse practitioner. So NPPs are also called physician extenders. All right, and basically NPPs are providers who have not obtained a medical degree. It's a provider who has not obtained a medical degree, and they can prescribe medication. They should have a provider number for the claim submission, and the physician referrals to an NPP must be documented in the patient record as well. There's payment schedules. So payment schedules are set the amount that the provider or facility can be paid for a service, and each payer has a specific payment schedule. So payment schedules are based on the payer type, like I just managed, whether it's a managed care or a workers' comp or Medicare. These are all payers. Under Medicare, physicians are paid based on the relative value units, or RVUs. So Medicare's RVU system is based on the cost or the overhead of the delivered care, the malpractice insurance, and then the physician's work. So this system is maintained by the Centers of Medicare and Medicaid Services. We'll talk more about this when we get into each individual health insurance later on in this book. So there's some office procedures that you'll need to know. So knowing the basic setup of the medical office and facility will help you to understand how the entire organization functions and how all parts relate to reimbursement. So understanding the flow of information is vital. So some procedures that will be performed during the workday in a medical office or facility will include scheduling appointments, registering patients, documenting encounters, entering charges, filing information, and then bookkeeping and accounting as well. So a medical assistant or an insurance specialist may be asked to help with all of these office procedures. So you really should look into the textbook more for more information on each one of these areas, and through your time throughout this course and your curriculum here, you will have a better understanding. So let's get into more of just the role of an insurance billing specialist and what that job entails. So there are several job titles that could be associated with the medical billing specialist, and the specific job titles may depend on the region of the U.S. in which you're working in. You could see billing specialist, an electronic claims processor, a medical biller, a reimbursement specialist, a medical billing representative, or a senior billing representative. So the billing department may have many employees that share responsibilities for billing, making the positions more specialized. So you can have other positions as well, such as a multi-skilled practitioner, or multi-skilled health practitioner, or an MSHP. And basically they're cross-trained to provide more than one function. So MSHP may have knowledge of claim completion and coding to provide more flexibility to the healthcare provider. Where claims assistant professionals, they help organize patient files, they help patients organize, file, and negotiate health insurance claims of all types. So CAPs can explain provider policies and assist patients in obtaining maximum benefits and explain provider policies as well. So some of your job responsibilities and things that you'll be responsible of. So job descriptions will vary from each position within the medical office. And if you look at pages 5 through 8, they will give you a couple samples of job descriptions there. So the administrative professionals may be responsible for claim processing, collection of the payments, and communication of the policy to the patients. So most medical providers will submit claims on behalf of the patient, regardless of which type of insurance plan that they have. These claims should not be rushed out the door, however, because there could be errors. Now there are many career advantages that go along here. Hold on, let me get to the correct slide. Jobs within the billing specialist field are available in a wide variety of areas, whether it be consulting firm or a clinic or a hospital. You could also be self-employed, which will mean more responsibility but could provide more flexibility for you guys. Positions can be part-time or full-time depending on the need. And then the positions in this industry may appeal to those who have who may be physically disabled, depending on their job functions. So the disabled workers here, the Rehabilitation Act ensures the access to information technology. So there's a lot of advantages to this career field. Some qualification and attributes that you need in this field. You need to have strong critical thinking skills. You need to have reading skills with good comprehension. You need to have some skills with basic mathematics, being a logical and practical thinker, and then you also have to be detailed oriented. Time management and social skills are equally important and necessary as well. Here's some more skills that you need here. So a solid foundation and working knowledge of medical terminology, including anatomy, physiology, disease, and treatment terms, as well as the meanings of abbreviations. You'll have to have expert use of procedural and diagnostic coding books and other related sources as well. You have to have precise reading skills and then those basic mathematics skills. So speed and accuracy are important if you develop your own business as a medical claims and billing specialist. The faster you become, the more money you will earn. Therefore, accuracy in selecting the correct codes and speed in completing claims becomes a marketable skill. In addition to all these skills listed here, personal image and behavior is important. Make sure to discuss the dress code with your supervisor and be courteous to coworkers and patients as well. Here's some more skills that you will need. So you'll have to have knowledge of medical legal rules and regulations in various insurance programs. You have to have knowledge of compliance issues. You have to have basic keyboarding and computer skills. You have to have proficiency in accessing information through the internet, knowledge of billing and collection techniques, and then expertise in the legalities of the collections accounts. So let's get into that personal image that we were just talking about. It's important to be attentive to your apparel and grooming. You should discuss the appropriate dress code with the supervisor before you take the job and going into it. Also discuss why fingernails should be kept carefully manicured and appropriate with the dress code. You don't want to have long, fake nails because that is a house for disease and bacteria to get under. And working in the medical field, that is not what we want. Let's also consult the employer for office policies regarding tattoos and piercings. And it's really important, guys, that you will be in a professional environment, and you must represent yourself that way. You're dealing with people's health and their money. So two of the things that are most important and dear to them. So it's important to take that professionally and personally as well. So behavior. A true professional needs to be able to get along with other people, maintain confidentiality of patients' medical histories and their ongoing treatments. You have to be a team player, which is an important one that I'm going to come back to in a minute. You have to communicate effectively and then never take part in office gossip or politics because that is just detrimental to yourself as a professional and to your clinic as well. So it is important that all co-workers' duties are seen as important because all co-workers are part of the team And in order for the team to be successful and to work efficiently, everybody has to be on the same page and getting along. So let's talk about medical etiquette. So there's a difference between ethics and etiquette. There are a difference between ethics and etiquette, and they are not the same. So etiquette is courtesy or consideration for others, whereas ethics are a set of standards of conduct that need to be followed. So if you look up here, medical etiquette is how medical professionals conduct themselves, whereas medical ethics are standards of conduct generally accepted as moral guides of behavior. And we're going to get into those ethics and etiquette right here. So these are the medical ethics that we need to know. So the first one, if you look on page 16, box 1-1 of your textbooks, you're going to look at the principles of medical ethics of the American Medical Association. So the principles of the American Medical Associations are not laws, okay? But they are standards of conduct that define the essentials of honorable behavior of the physician. So it is your responsibility as a coder to inform the administration or any immediate supervisor if unethical or possibly illegal coding practices are taking place. So here are those AMA Principle Code of Medical Ethics. A physician should be dedicated to providing competent medical services. A physician should deal with patients and colleagues with honesty, dignity, and will expose any colleagues who engage in fraud or deception. A physician shall respect the law as it relates to the practice of medicine. And we'll continue on with those. A physician shall respect the rights of patients within the constraints of the law. A physician will keep up with the latest findings and medical advances to continue to provide the best possible care to patients. Except in emergency situations, the physician is free to choose where and to whom he or she will provide medical services, and a physician will participate in the promotion of community of goodwill. Okay? So those are the AMA Principle Code of Ethics. So if you look on page 18 of your textbooks in figure 1-7, you will see the AHIMA's Code of Ethics. Okay? So the American Health Information Management Association, AHIMA, has a separate code of ethics which is appropriate for persons handling health information, whether they are health information specialists, insurance billing specialists, or coders. So health information management professionals, okay, respect the rights and dignity of all individuals. They will comply with all laws, regulations, and standards that govern the practice of health information management. They strive for professional excellence through self-assessment and continuing education. And then they truthfully and accurately represent their professional credentials, education, and experience, and adhere to the vision, mission, and the values of the association. They will also promote and protect the confidentiality and security of health records and health information. You will strive to provide accurate and timely information. You'll promote high standards for health information management practice, education, and research, and then also act with integrity to avoid conflicts of interest in the performance of the professionals and AHIMA responsibilities. So, both of those are both sets of code of ethics that we as healthcare professionals need to abide by. So let's talk about some employer liability with our jobs. So physicians are legally responsible for their own conduct as well as any action of their employers performed within the context of their employers. So the physicians are legally responsible for the staff actions. They are known as the respondent superior, meaning let the master answer. Okay? So actions of the insurance biller may have legal ramifications on the employer. So insurance billers should check about coverage under the physician's malpractice insurance. If not, they may be personally liable for any issues that arise. So if you are involved in any part of the claim submission, you can be held responsible for these errors. So billers and coders can be held personally responsible for billing errors. Errors and omissions assurance may be necessary if the biller or coder is personally liable. So that might be something you want to look into. So really look at the malpractice insurance of the provider and see if this would be covered. Errors and omissions assurance is protection for errors or unintentional omissions as billing and coding specialists. So billing and coders must correct errors and document all actions in writing. So let's talk about the scope of practice real quick. So certain states require that CAPs or claim assistant professionals be licensed. Even without a license, a CAP is not a lawyer. The Alliance of Claims and Assistance Professionals, or ACAP, represent CAPs and can help with questions without licensing, liability, and insurance. So claim assistance professionals, they're basically an informal representative of the patients, and they will assist in obtaining reimbursement for their procedures. They have a legal ability. Their legal ability is limited, and they may need a license as well. So each of these future challenges that I'm going to talk about will make you a better insurance biller. So know these and know what to expect going into it. It's important that you know all billing regulations for all payers or insurance coverage, whether it's Medicare, Medicaid, or TRANVA, or HMOs, or workers' comp. Okay, it's important to know the billing regulations associated with them. Know aspects of compliance rules and regulations, the state rules about patient treatment and referrals. You need to be proficient with your computer skills. You should learn electronic billing software for each payer, and then develop diagnostic and procedural coding expertise. And then finally, all of these challenges will make you more effective within your profession. You need to know how to interpret insurance documents and attain bookkeeping skills to manage patient and practice accounts. You need to be able to stay up to date with industry news, cross-train in areas of practice management, and then always strive towards becoming certified and seeking continuing education. And throughout this course, guys, that's exactly what we're gonna help you guys obtain, is that certification. You're taking this portion of the curriculum to become certified as a billing and coding specialist. So that is really important, guys. Really take this material seriously. It is your future, it is your career, and it is very important in the healthcare setting. Like I said, you're not only dealing with people's medical issues now and people's health and well-being, but you're also dealing with people's money. And those are two of the most important things in the population around us. So if you have any questions over the material, guys, come and check up with me. Like I always say, these lectures are a great overview of the chapter, but they do not get into every detail. So really take the time, educate yourself, and learn the material before going on and moving forward. Again, if you have any questions, please feel free to come and ask me. Good luck on the material, have fun, and let me know what I can do to help.